My name is Charles Jones. I'm a nurse student here at the University of South Alabama. Today I'm going to be doing the medication administration clinical checkoff. When you do the medication administration, you want to make sure you're in an environment with no interruptions. To do that, you want to make sure the door is closed, do not answer any phone calls, make sure you do not talk to any colleagues unless it's prescribing to something useful for your patient, and make sure you adhere to the no zone interaction zone or no interruption zone policy. No interruption zone policy. Next, I'm going to make sure my patient care order form has been copied over to the medication administration record correctly. So first I'm going to check patient, which is Jaguar J. Jones, date of birth 8/25/1963, date of birth 8/25/1963, allergies penicillin. Next I'm going to go to medication, which is Novolone R regular insulin U100, Novolone R regular insulin U100, and it says to give that subcutaneously, 10 units, 30 minutes before meals. So my medication administration record has been copied from the patient care order form correctly, so I'm going to get rid of the patient care order form, and I'm going to perform hand hygiene. All right, now I'm going to the first step of the 7 rights, and I'm going to start with the patient, which is Jaguar J. Jones. And then I'm going to move to the medication, which is Novolone R regular insulin U100, which is right here, Novolone R regular insulin. Expiration date is 12/1/2025, so it's not expired. I am going to be giving this injection subcutaneously, so I'm going to use my insulin syringe, which is 29 gauge half-inch syringe. And I'm going to do 10 units. So I'm going to put 2 units of air, and I'm going to clean the vial. Next, I'm going to uncap my syringe and put 10 units of air into the syringe now. I'm going to push the 10 units of air in, and then slowly come back out. Come back a little bit to 10 units. And all the air bubbles out. And I'm going to put my lid back on using the scoop method. I have 10 units of insulin. And I'll give this 10 units of insulin 30 minutes before meals, and to patients that have been diagnosed with diabetes mellitus, and all elements of legal prescriptions have been included. All right, next I'm going to be doing the second right. So first I will do Jaguar J. Jones, and then I'll go to medication, which is Novolone R regular insulin, which I put into my insulin syringe, and I will give this subcutaneously, which is why I have my subcutaneous insulin syringe, and I have put 10 units into the syringe. Make sure one more time I put 10 units into the syringe, which I have. And I'll give this 30 minutes before meals to patients that have been diagnosed with diabetes mellitus, and all elements of legal prescriptions are included. And now I will make my label for my insulin syringe. On this label, I will put the patient's name, which is Jaguar J. Jones. The drug that is being injected, which is Novolin R U100 insulin. And I'm going to administer 10 units, so I'll write that 10 units down. And now I will take my vial and my syringe and my MAR to the patient's room. So I've entered the patient's room. I will perform hand hygiene, and I will explain the procedure to the patient, which is a subcutaneous abdominal injection of insulin, and I will move the bed up to a working height and remove the bed rails. And now I will start the third step, or the third 7 rights, which first is going to be the patient, Jaguar J. Jones, date of birth, 08/25/1963, 08/25/1963, and allergies are penicillin. See right here, allergies are penicillin. Is there any other allergies you'd like to inform me of, Jaguar J. Jones? All right, very good, no other allergies noted. Next, I will go to the medication, which is Novolin R regular insulin. Right here, I can see I have Novolin R insulin into my syringe, and I'm giving it subcutaneously in the subcutaneous insulin syringe, and it is 10 units. I can see right here that it's 10 units, and I'll check one more time. 10 units. Very good, it's 10 units. And I'll give this 30 minutes before meals, and it's 30 minutes before your next meal, so you'll begin this subcutaneous injection. And patients that have been diagnosed with diabetes, mellitus, are candidates for the insulin shot. And all elements of legal prescriptions are included. Now I will perform hand hygiene, and I will don my gloves, or I will put on my gloves and goggles. Put on my goggles. And I'm giving a subcutaneous abdominal injection, so I will do that below. I will not go above the costal margin, and I will not go below the pubis region, and I will do it in between the anterior and superior iliac spine. And so next I will. And I'll also do it above the 2-inch border of the umbilical. And now I will clean the patient's injection spot, starting from the middle, doing a circle outwards, not going over a spot again. Dispose of that. And while I'm doing that, I will check for a skin tiger and any bruising. Now I'm going to give the subcutaneous injection to the patient, and I'm going to uncap the syringe and pinch a 2-inch skin margin, and I'm going to inject at 90 degrees because I have gotten 2 inches. I'll inject straight in. I pull straight out and put in the sharps container and apply the alcohol wipe to the injection site. And now I will take off the glove. I will take off my gloves and goggles. I'll move the patient back down to a comfortable height and move the bed rails back up. And I will document the patient's response and the procedure on my Mars, and I would check back in 30 minutes for any adverse effects from the insulin. And that concludes the medication administration clinical.